A very warm welcome to all our viewers over here at BW Healthcare World's Oncology Summit 2023. We have here with us today Dr. Kanchan Kaur. Ma'am, thank you for being here. So, my first question to you is the overwhelming prevalence of cancer today is already established. How well are we fighting it?
So, as you rightly mentioned, cancer is becoming the next almost pandemic for India, and we can fight it well. The problem is that lack of awareness makes patients come at later stages, and there is lack of standardized healthcare in the community. This, coupled with lack of awareness, leads to patients presenting late, which sadly leads to poorer outcomes. And if in the community all that you're seeing is suffering and death because of cancer, that fear of cancer becomes bigger. So sadly, we are not tackling it as well as we should, because if cancers present early, if patients are cured, if patients undergo treatments without the amount of suffering that a patient who presents in later stages will have, the message that goes out to the community is that cancer is not something to be scared of. If you detect it in time, treatment modalities have become so good that most cancers now have very high chances of cure.
I have two aunts who have had cancer. One survived, one did not. So it's a mental thing as well. I mean, the mental journey that a person goes through, yes, that's immense. And I think that plays a huge role. It is also predicted that in the next 5 years, the cases of cancer will drastically increase. What do you have to say about that?
So yes, cancer cases are on the rise. In fact, if I just talk about breast cancer, we know that from 1985 to now, breast cancer cases have almost doubled. A lot of this is also because cancers are getting picked up early. The awareness levels are on the rise and cancers are getting picked up early. And because we know that cancers are on the rise, more cancers are being picked up, it makes it all the more important for us to increase levels of awareness so that cancers are detected early. But to be able to detect and treat them early, unless we have the kind of infrastructure that is needed to detect and treat cancer early, then all goes to a waste. So it has to be a multi-pronged collaborative effort, both on the public and private sector, but also of a willing community that is willing to come forward. I can open up 10 good mammogram centers, but if a woman doesn't believe in screening, doesn't believe in coming forward, then we are not going to, go ahead in this race. So the only way to stay ahead in the race and to win the battle against cancer is a very simple word, that is awareness. Awareness that if it is picked early, it is treatable.
More than 70 years since we got our independence, how much time more do you think we need for proper awareness about cancer?
No, I'm hopeful. I'm hopeful, and I think this coming generation, the media savvy generation, if the healthcare providers can tap into spreading messages through the amount of media that we have, like we did for COVID. Even an uneducated rickshawala knew the difference between the types of vaccines that were on offer. So it all boils down to awareness, awareness, awareness. We have definitely seen increased level of awareness. We are seeing a will, at least on the part of the government, to do more. Private players are definitely doing quite a lot. So I think I have hope that at least in my lifetime, we will see a change in the landscape for the better.
Let's really hope that happens. What role do you think tech is playing in oncology in India? What impact is tech having in the oncology scenario in the country?
So see, tech has now pervaded all aspects of our lifestyles, and obviously in the onco world, right from the methods of screening which have improved, the methods of AI that are being applied to diagnostics, to the better equipment that we have to treat patients, be it surgical treatments or chemotherapy treatments, radiation treatments, technology has gone a very long way in making them more and more safer. So there is no doubt that the way forward is with advancements in technology. But then again, it boils down to, is your audience captive enough to want to take on those advances, Is your audience sensible enough to want to come and do the screening tests when there is no problem?
Last question. From a personal perspective, what are the things that one should do to prevent cancer? To make sure that that day doesn't come when they get the bad news?
So cancer, by and large, most cancers are lifestyle diseases, okay? So we know that India has a huge burden of oral cancer, which is cancer of the mouth. Why does it happen? Because we chew pan and tobacco. Okay, so simple lifestyle changes: not to consume things like pan, tobacco, reduce your consumption of alcohol, have a healthy lifestyle. And when we say healthy lifestyle, it's both mental and physical. A stress free lifestyle, eating well, eating healthy, exercising. I cannot stress that enough because that plays a huge role. And above all, awareness of changes in your body. With a lot of cancers, dramatic symptoms don't happen immediately. You keep thinking, agar cancer hoga to kuch hoga jo mujhe pata lagega. But a lot of cancers are very silent in their early presentation. So for anybody, along with healthy lifestyle, having healthy habits which allow you to seek screening tests. When you are healthy, do you go for a pap smear as a woman? When you're healthy as a male, after a certain age, are you doing the test to see whether prostate cancer can develop? Are you doing a mammogram? So things like this, unless you make that lifestyle change, you're not going to go forward.
May I ask you one last question? Uh, I've seen, I have a lot of friends who are into medicine. They're nurses, they're doctors. I've seen that they're the ones who smoke the most. What do you have to say about that?
Well, if only the preacher would always follow what they preach. So I agree with you because I think doctors, nurses lead more stressful lives than a lot of other people. They end up doing things that they tell others not to do. So I definitely do not support that. And unless we lead by example, nobody is going to follow us.
Thank you so much, Dr. Kaur. Thank you so much.
I